information series, How to Eliminate Joint Pain in 3 Easy Steps. You'll see in front of you, you have a workbook. It goes through the workshop in detail. And also, if you'd like to follow along, some people, they like to follow the workshop along with me. Let's talk a little bit about joint pain. Everybody has it. It's all based on age. Seems like the older you get, the more joint pain that you have, but also growing up we have joint pain too. There's growing pains in our bones and our joints. People often think that because they're getting older they have arthritis, and the true definition of arthritis is just a painful joint. And I often tell patients that people in high school have arthritis because when they're done with football practice or basketball practice they end up with a lot of joint pain. But it's not because they're old, it's because their joints are inflamed. So inflammation and swelling happens to all ages. You can pinch, poke, misalign the joints, and also pulling muscles. And there's pulling versus tearing versus autoimmune responses. So now we've got joints and muscles from slip, trips, and falls, from working out. We start pulling and tugging on our joints and we get inflammation process. But the other one is an autoimmune system where the body starts attacking itself and causing inflammation as well. Other types of inflammation in the joints and other areas it's kind of based on genetic predispositions or allergies. People have allergic reactions to things. Often shows up in the joints. And there's like gout and things like that where you actually have the body's inability to remove certain things, and it turns up as acids inside the joints too. The next one on your workshop series worksheet is synovial membranes. And I like to refer to the synovial membranes as the janitor of the joint. So it maintains, like in the school there's the janitor, takes care of the school, picks up all the junk and gets rid of it and makes the school nice and clean for the next day. Well, that's what the synovial fluid and the synovial membranes do inside your body. And the inner membrane of the synovial joint, called the synovial membrane, it secretes synovial fluid into the joint cavity. And this fluid forms a very thin layer at the surface of the cartilage, but also that's what seeps into the microcavities and irregularities into the joint. So a joint that moves pushes this stuff and fills in all the cracks. But if the joint can't move, then the synovial membrane can't secrete the fluid into the joint. So some people think that if they don't move their joint that it's going to get better, but it's actually the other way around. If you have an injured joint, the more you move it, the better, even if you have arthritis. And we'll talk a little bit about pool therapy in a minute. But basically, during the movement, the synovial fluid held within the cartilage is squeezed out mechanically to maintain a layer of fluid on the cartilage surface, which we call weeping lubrication. Now, the synovial membranes themselves, it's a very thick, stringy fluid found inside the cavity of the synovial joints, and it's an egg-like consistency. So basically, synovial is partially derived from ovum, which is Latin for egg. But the synovial fluid reduces the friction, which is really important. If you don't have synovial fluid, when your joint moves, it creates heat and friction and starts to wear out the joint and can cause inflammation that way. But also other tissues in the joints as far as lubricating and cushioning them during movement. So without this fluid, your body doesn't have a cushion. You don't have a way of dispersing the heat as far as grinding the joint. So again, it's very important that the synovial fluid mechanism works. And one of them is to make sure that the joint itself has enough blood supply around it to function properly too. So with injury, if you have joint misalignment, that's exactly what chiropractors do. And I've been talking about synovial fluid as if it's in a wrist or an elbow or shoulder, but also in the spine. There's joints in there too that need to have movement to keep and maintain that synovial fluid. So a lot of times when people have stiffness in their back, they think it's something they have to live with because they have arthritis, when just the opposite is true. If we can get in there and adjust the joint and manipulate that and get that synovial membrane excreting or secreting fluid back into the joints, then you can maintain better joint movement. But it's usually painful at first because you have to get that process moving again. through the adjustment. So 45% of the people can get sore from the adjustments because we're actually initiating that process. So next on the list is move it or lose it. That's what I've been talking about. If you don't move the joint, it's going to not produce the synovial fluid. So there's pool therapy. If it hurts to get up and walk around, and I have a lot of people that either through weight issues or just the fact that their joints don't move so well and it just hurts to walk, they've got plantar fasciitis or something like that. If you can get into a pool, and on our website we're going to be listing Linwood Shoreline and also the new YMCA that's on 99 as far as the pool times. You can actually go in and just walk around in the pool for a half hour is enough where you can move your joints and get that fluid working without putting a lot of weight on your joints, and that's why pool therapy is really good, especially people who have like rheumatoid arthritis. But also walking on level ground is really important, and with the cold weather, or if it's bad weather, get a good pair of shoes, put in some back guard orthotics that you can get at Walmart or something like that. You have a nice cushion to walk on. Just start doing laps around the mall. Spend 20 to 30 minutes just walking is good enough to help with the joints and getting them lubricated. If you have bad knees and you want to stay in shape, usually walking on level ground is tough, or jogging kills you. So we have hills that we have people, if you find about a 15-degree hill, you do sprints up the hill and you walk down and sprints back up the hill. It's a really good cardio workout and you don't kill your knees. And we'll have that information available too. If you have any questions, just give us a call. There's a Tai Chi Move. They're basically squats where you're moving the joints, and basically it's tough to start out with. You only want to do about 15 at a time and try and work up to about 100 a day. But you're basically just going straight down and then coming back up and using just your legs to do that. And that's something that's based on individuals. Not everybody can do that. And again, talk to one of us and we can show you how to do that. Heat versus ice. People usually talk about, you know, do I need to ice this joint? Do I need to heat it? What's the best thing to do? And so if you hurt your joint and it's within the first 48 to 72 hours, always ice it, because the joint's starting to swell up, and that swelling that's in there is not synovial fluid. It's a different kind of fluid. And once that fluid is in there, it takes forever to get out. It can take up to 10 weeks for that fluid to get out of the joint. So if you can stop that fluid from going in the joint, you've saved yourself about 8 weeks of healing time. So always ice and compress the joint when it gets hurt for at least 72 hours, because the enzyme that creates the swelling is alive for about 72 hours and then just dissipates on its own. However, some people think because heat feels so good, they're going to put heat on the area. Well, that's the same thing as putting bread dough in the oven and turning up the temperature, and everything starts to swell and rise. Even though heat will numb the area, now you've increased the joint swelling even faster with even more fluid, so it takes even longer to heal. So an acute injury, something that's brand new, ice. If you've had joint problems and it's, you know, you're